The rights to safe water and improved standards of sanitation and hygiene are fundamental human rights enshrined in the Constitution of Uganda. However, in spite of government's effort to increase access to safe water, over 12 million people in Uganda do not have access to safe water. This report represents a case study of Namayumba Town Council where, for a very long time, a big percentage of population have been accessing unsafe water. And where there is no safe water, people cannot wash their hands with soap and maintain good sanitation and hygiene standards. This means that the preventable diseases like cholera, diarrhea diseases, intestinal worms, and even COVID-19 can easily spread from one person to another. The provision of safe water, sanitation, and hygiene is essential to protecting human health during disease outbreaks like COVID-19. In spite of its proximity to the capital city of Uganda, Namayumba Town Council, located in Wakiso district, is known as the Karamoja of Wakiso because of severe scarcity of safe water. Currently, only 49% of the population in Wakiso district have access to safe water. In Namayumba Town Council, the situation is dire. Only 2 out of the 17 villages have access to safe water.
Enzizi zonna nkyafu, ente zinywera muli, abantu basobola okufuka omusulo ne guyingira muli, ebisolo binywera muli n'emisota.
Omusana bwe gwaka tetufuna mazzi, tuganona ku mageri mayanja.
Ekyamazima ebitundu byaffe ebisinga bino bya ntobazi, tugeze nga wano ewamika. Tetukyayinza amazzi gaawo ne booganywa aga bbowazi olabaawo tegawooma. Bo gafumbye gabaamu solote.
Abaana baffe abawala ku nzizi eyo bwe bagenda bonoona obudde, bafunirayo ebizibu, emboozi ezinyumizibwayo ziba nnyingi, engambo zeeyongera mu bakyala awaka, ate awo ne wabaawo n'obutabanguko.
Era amazzi gaffe water table yaffe eri wala. Tubadde tusima shallow wells nga tezikola bulungi, eyinza okukolayo myezi bwezi n'ekola ki n'efa. Bowahoze twalina za water table zaayo ziri wansi ne bazikanika, abantu beesolozaamu obusente naye era amazzi ne gagaana okukola ki okujja.
In 2019, UWASNET, in partnership with VAD and financial support from the Danish People's Aid, began implementing the civil society action for improved wash services in Uganda. The 3-year program aims at contributing to improvements in quantity and quality of wash service delivery in Uganda, Kenya, Tanzania, and Somalia by 2021. This is in line with the United Nations Sustainable Development Goal targets under SDG 6, which aims at increased access to safe water and affordable drinking water at national or local levels, improve sanitation facilities and hygiene practice nationally or local level, and an end to open defecation. Increase government financing of WASH at national and local level and social accountability, and improved WASH governance structures through enhanced participation of local communities or civil societies. As part of the program, UWASNET, in partnership with VAD, trained a total of 50 community advocacy committees in Namayumba Town Council to advocate and lobby for increased safe water supply. The Community Advocacy Committees are community-driven advocacy structures developed in 2019 to identify critical gaps in the service delivery and together develop an effective advocacy strategy to engage the respective duty bearers with the aim of improving WASH service delivery. In 2019, VAD worked together with the local council leaders in the 5 wards of Champisi, Chanuna, Lutisi, Namayumba and Luguzi to identify active community members to constitute the membership of each advocacy committees. In total, each advocacy committee has 10 advocacy committee members who include the local council leaders, community focal persons, community members and village health committee representatives. The advocacy committees were empowered with knowledge and lobby skills, knowledge to formally engage their respective duty bearers and contribute to informing decisions that affect their lives and overall well-being. The advocacy committees identified the issue of lack of access to safe water as most critical. They developed an issue paper which included the status of WASH service delivery in Namayumba Town Council, number of unserved populations, and recommendations to improve WASH service delivery.
Twakwata issue paper yaffe eyo ne tugitwala ewa town clerk era olukiiko olwo lwali luzito nnyo, lwalimu town clerk n'olukiiko lwe lwonna, ne mbeeramu bakansala ne mmeya ne tubakwanga ekiwandiiko kyaffe nga kiriko emikono 120.
Manya abantu baffe wansi eyo bw'aba n'ekizibu akikuleetera naga temutuyambye naye ng'ekyamazima naffe abakulembeze tetwalyagadde bantu baffe bayaayaane.
Even though there are processes that call for citizen involvement in decision-making, quite often these spaces are not utilized by the community members because they lack the skills, knowledge, and access to engage their leaders in these formal spaces and participate in decision-making. As a result, a number of decisions are made without their involvement.
Listening to the voices of the local communities, it helps you to guide you, knowing the right direction that the community wants to take, and most especially when those voices are positive, when there's an issue they are raising up, and the moment you listen to them, they become part of you. You become a team, and when you're a team, you can lobby. When these people in higher offices see a team coming up, not an individual coming up, they definitely respond.
The voices of the community members yielded results. In May 2020, the Ministry of Water and Environment, through the Central Water Development Facility, submitted a project proposal to the African Development Bank, which, upon approval, will facilitate all the 17 villages in Namayumba Town Council with piped water supply. The Central Water Development Facility is part of the centralized structures instituted by the Ministry of Water and Environment in Uganda to provide services closer to the public. It is responsible for provision of piped water supply in small towns and rural growth towns. The Central Water Development Facility covers a total of 29 districts in Central and Bunyoro regions in Uganda.
As you are aware, the population growth in most of the upcoming rural growth centers and small towns is so high. The water systems in the situation of Namayumba are so many that even the limited resources that we do have, you find you cannot so quickly meet the demand that is there.
If the funding proposal is approved, work on laying the piped water system will commence in 2022, and in 2023, everyone in the Namayumba Town Council will access the safe water supply.
We have just started the detailed design, and we hope that by October we should have completed the design process such that when the African Development Bank comes to carry out the appraisal, at least we have the complete project document,
we launched the project a few weeks back, and the surveyors have already started surveying the area. Socialists have come up trying to interview the people. The project has already kick-started, and we have very much hope that this project is going to benefit our people because they are going to access safe water.
After achieving this milestone, more work needs to be done. The Advocacy Committee members have plans to continue engaging and participating in all the processes leading to the completion of piped water system and ensuring access to safe water for all in Namayumba Town Council.
As an advocacy member, if this pipe water system is constructed, I will take part in monitoring to make sure that it is constructed in a good way, to make sure that the materials they use are those of the right standard, to make sure that they are not stolen, and to say that they install public stands so that every household or every resident can access it conveniently.
Nze nsaba omulimu guno bwe guba gutandise fe abakulembeze mutu involving abantu baffe tubaagazise tujja kutambula nammwe abantu baffe bali ready okusasula amazzi bali ready okubatera tap buli muntu ewuwe.
Yes, the project will not be able to connect each and every person, but we'll have infrastructure that can aid everybody to get connected. We are yet to determine how many we shall include in the project. It will depend on the available resources, but what our dream and our target is to make sure that there is capacity for each and every household to get connected by privately.
Okubeera n'amazzi awaka kituyamba obutafuna buli ndwadde ejja kubanga oba weekuumira wakaawo oyonja awakaawo onaaba mu ngalo ng'ovudde eri ewala naye kaakati bw'oba wagenze eri osanga ate oli ataanaabye mu ngalo ng'akutte ku kisunda amazzi ate gw'ojja n'akawuka obulwadde ne buyingira mu maka.
Research shows that around 70% of the illnesses that affects our people comes as a result of not having access to clean, safe water. So we hope that by the completion of this project, people will be having access to clean, safe water, and there will be definite reduction in the illness. So when people are not sick, they will be able to work hard to sustain their families, and we hope they shall be meeting the target of the president of the middle income status of people and increasing of household income. People will be healthier, will be able to work for themselves, and I hope there will be less problems in the community.
The biggest lesson for the Advocacy Committee members has been the realization that advocacy works and that community members can indeed contribute to the impact service delivery when their capacities are strengthened and given access to participate in decision-making and monitoring service delivery through mobilization and organization of their voices on key issues that directly affect them.
Tugenda kukolaganira wamu okulaba nti tubabeerako ekintu kye baatusuubiza kireme kugwa butaka. Bingi babisuubiza ne bikomaawo mu ntandikwa ne bigenda. Naye nga bwe twafuna omwogezi w'ekitongole ekyo nga wamu LC yaffe tubadde tusuubira okulaba nti tugenda kwongerwa kubabeerako okulaba nti ekintu ekyo kigenda mu maaso tusobole okufuna amazzi amayonjo.
As communities, if we continue to engage our duty bearers through advocacy, we can get better services from our leaders.
Leaders in my capacity, leaders in local governments, leaders in lower local governments, they can do something as well to change the status of their communities to access water. They need to shout, they need to mobilize, they need to make friendship in order so that they can achieve safe water in their areas, because it's only safe water that can stabilize the communities and can gear the progress of the development in different aspects in their communities.
I know WASNET has been advocating quite for a long time for increase in the budget of financing water projects. I would still maybe request you to continue so that by that, if everybody understands that everyone needs clean and safe water, then maybe we would have an improved budget, and once we have an improved budget, then we should be able to serve more people.